It's California Edition. I'm Brad Pomerance. Dr. Ed Hernandez is joining us. He is a member of the California State Senate. He is chair of Senate Health. And I'd like to speak with you about the Affordable Care Act. We are now significantly past the deadline. And I don't have a horse in this race, but it seems as if, especially in California, the Affordable Care Act rolled out pretty well.
Yes.
And we see a lot of folks receiving health care in California that didn't have it before.
Yes, to the tune of over 3 million new Californians, about 1.8 of them in Medi-Cal. We are light years ahead of the rest of the country. Unfortunately, there's been a court ruling, or they're trying to challenge the subsidy at the federal level.
And let's talk about that for a moment, but I do want to talk more specifically about the numbers, because if I remember correctly, before the ACA, California residents about 22% uninsured. Now it's down to 11%.
Yeah.
I mean, that's in 1 year.
Well, so that tells me one thing, most important. What that tells me is that there was a need and consumers want to have health insurance. Many of them were locked out because of pre-existing conditions. They had a job that didn't offer it, and they couldn't afford it. You now have federal subsidies that are making it affordable for most, if not all, Californians.
So let's talk about federal subsidies, because we know that the opponents of the Affordable Care Act are vigilant in their attempts to dismantle it. And interestingly, recently, on the exact same day, 2 appellate courts ruled on the question of whether the ACA allowed federal subsidies to be given to states that don't have their own exchanges. Now, we in California have our own exchange, so that's not an issue. Where do you see that question going?
Well, I mean, obviously, I think it's in the interpretation of the law. I think it's incorrect. I think that the law was written in the intent, because the judges have said, yes, there's an intent. And I think eventually it'll move in that direction. But as you mentioned, California is not a concern, because we have our own exchange, we're taking care of it, and we're seeing those patients as well.
And as I understand it, one could argue that a state could simply say, we deem healthcare.gov our exchange, and therefore it would seem that it would even comply with the ruling out of I think it was the DC Circuit, that was less than favorable to the Affordable Care Act. I do want to also talk about Medicaid, because with success comes success. And we were very successful in California on the Medicaid expansion, so much so that we didn't necessarily have enough money to pay for the Medicaid expansion, because as I understand it, the federal government pays for 100% of those that would not have been covered pre-ACA, but for those that would have been covered pre-ACA, the state still has to pay 50%, is that right?
Well,
sort of?
Yes, sort of. and here's the distinguishing factor. Up until the Affordable Care Act, anyone under 100% of federal poverty level, we have what's called a 50-50 match.
Right, exactly.
So the state would pay 50%, the federal government would pay 50%. With the Affordable Care Act, from 100 to 138%, the federal government pays 100%. Now, we did such a good job outreaching to the population and said, look, come sign up, you may be eligible for Medi-Cal. There were patients out there who were always eligible, but never signed up. So when they called in and signed up, well, guess what? There was a lot of individuals that were going to have to pay the 50%. That's where we were on the hook. But that's a good thing. That's a good problem to have.
And as I understand it, there was an additional supplementation, I guess, for the funding in the recently passed budget.
Recently passed, but the good news is the budget is passed. We had enough money to pay for it. The economy's picking up, unemployment's down, revenues are up higher than they've ever been. This is the biggest, largest budget we've ever passed in a long time.
When I was speaking with you about the Affordable Care Act as it was rolling out, I think it's fair to say that I was asking pointed questions about individuals of Latino descent. Your district has a significant number of Latinos in it. And the questions were, why aren't Latinos signing up? What's happening here? Latinos have a disproportionate number of uninsured. They're not signing up. But wow, I mean, by the end, Latino numbers were really on par with population. What happened?
What happened is Covered California tried a marketing strategy. They understood very early on that it wasn't working. We met with the legislature, our office, the Latino caucus met with them, and they readjusted. And they readjusted appropriately. And the numbers are now mirroring But more importantly, if you look at the percentage of Latinos within the Medicaid population, it is well represented, because there's 1.8 million in Medicaid rolls and the rest made up through Covered California. But yes, a significant number of Latinos have been enrolling just recently as well.
And as part of it, because as I understood, a lot of what we were seeing with the Latino population is there was a general, almost fear factor about signing up for a government program. There was a sense, especially with, the mujeres, the older family matriarchs, that they came from, maybe they were immigrants, legal now, in their countries, they didn't want to get involved with government programs. Did you have to kind of re-educate that this is different?
I think it's the cultural sensitivity more than anything, and I think the marketing strategies have moved to be able to communicate, whether it's in Spanish language, Spanish television, and it's not just Mexico, it's Central America, it's South America. I mean, there's a whole diversity of Latinos, from Cubans to Central Americans. So the marketing strategy needed to change, and it's changed.
Can I shift gears and ask you about immigration? I know we weren't planning on it, but I'd like to ask you about immigration, because, like I suggested, you represent a large number of Latinos in your Senate district, and we know that there's a crisis right now with unaccompanied minors coming to our borders, California, Arizona, Texas. Are you hearing about that through constituents? I mean, there's a lot of national noise about it, but on the ground, and you've been home because we've been out of session. So are you hearing chatter about it?
Not necessarily. We haven't gotten a lot of calls. I think where you're hearing most of the chatter is in the areas where those immigrants are going to be placed temporarily, like out in the Inland Empire. I mean, there's a lot of media attention, obviously. But I don't sense, and when I talk to my staff, we're not getting a lot of calls from our constituency right now.
Because I'm wondering if some of these unaccompanied minors have relatives. You would think, we're in the greater Los Angeles area, that there could be family members they're seeking, but not necessarily.
No, and unless those individuals don't really understand to reach out to their elected officials, perhaps because fear of deportation, et cetera. So our office really hasn't been getting a lot of calls on that.
There's a lot of fear also surrounding the drought.
Yes.
It is hot, sir. It has just been blistering. And when you look at the statistics as it relates to weather and temperatures, we are breaking records day in and day out. What are you hearing from your constituents on this? Or is the problem you're not hearing and people don't recognize that we're in a crisis?
Well, I mean, we're hearing, but at what I would consider very, very low levels. But I will tell you, though, that the public is very aware of it.
Are they?
The most recent PPIC polls are showing that the public says, yes, that's the number one concern that they have. And I think they say that because it's in the media so much, the drought. For example, in Glendora, there was a woman that was charged for not watering her grass, but yet she was told by the state of California to reduce your amount of water consumption. So it's in the public's mind right now, but it's extremely important that we understand, and we need to have a water bond on the ballot this
We'll
November.
see what happens there. It's interesting, though, you mentioned about that it's on top of mind. I was looking at a poll, USC LA Times, 89% characterize the drought as a major problem, a crisis, but 16% have said they've been affected to a major degree. So, I mean, part of it is, we've been so smart about how we've been dealing, and here we're in Southern California today with potential crises, that we're actually doing better than our friends in Northern California. So we're not feeling the pain, and so we've seen actually water usage spike a bit in coastal California, Southern California.
Here's the reason why those numbers are the way they are, is the water entities in the state have done such a good job that consumers haven't been affected. You want to know when that's going to go up is when their rates go up significantly.
And when they start getting fined.
Yes, then you're going to hear an outcry. But most consumers, they take water for granted.
His name is Ed Hernandez. He is a member of the California State Senate. My name is Brad Pomerance, and it's California Edition.